Welcome to Practice Plus Group. In this video, you will follow a patient through their journey from referral to arriving and completing their endoscopy procedure with us. Once we have received the referral from your GP or consultant, we'll then review the information and discuss symptoms, past medical history and medication with you over the phone.
Your GP has asked us to give you a call because he or she was worried about what was happening.
During this discussion, we will ascertain which would be the safest and most appropriate test to book for you. You will then receive another telephone call within a few days from a member of our pre-assessment endoscopy team. The telephone assessment is to give you more information about your procedure. If you're having a lower endoscopy, also called a colonoscopy, we will discuss the low residue diet you need to follow 3 days before you are due to have your procedure, fasting instructions, and the oral bowel preparation medication you need to take and, if appropriate, how to administer a disposable enema prior to coming in on the day. If you need to stop any of your prescribed medications, we'll also go through this with you. There is a choice of light sedation and/or Entonox, gas and air, which you can have during the procedure to help manage any discomfort that you might experience during the test. If light sedation is preferred, you will need to have someone collect and stay with you for 24 hours after the procedure. During this time, you are also advised not to drive or work as the medication wears off. If you choose Entonox gas and air on its own, you can drive 30 minutes after your procedure and continue with your normal routine. You will also be asked if you have any concerns, questions, or would like a further explanation of anything to expect. On arrival, you will be greeted by a member of staff.
If you'd like to come with me, I'll show you where you need to go.
Either a registered nurse or reception staff who will mark you as arrived and direct you to our waiting area. The person accompanying you can either wait with you or leave and come and collect you after your procedure is finished.
If you'd like to follow me, I'm going to take you through to where we're going to do your pre-med.
Soon after arriving, one of the team will come and collect you and take you through to a private room where we will check to see if there have been any changes since your pre-assessment and do some more observations of blood pressure, pulse, oxygen saturation and temperature. A nurse will also insert the cannula if you have chosen to be sedated, before you'll be shown to a single-sex waiting area.
If you'd like sedation, we need to check a few things. Have you got somebody collecting you today?
Yes, I have.
Yep.
Afterwards, we will then check which sedation you have chosen to have. And if it's light sedation, we'll document who's collecting you. You will then be directed to change into your gown and the dignity shorts you'll wear during your procedure. If you're wearing a short sleeve shirt or t-shirt, you can keep this on under your gown. Each of the cubicle areas has a red cord bell you can pull at any time to alert our staff if needed whilst you wait. It is advisable to bring some reading material with you, as you can be on the unit for 2 to 3 hours. Our consultant will then come and meet you and take you through to the private consenting area to discuss the procedure.
I'm Simeon Brundle, I'm one of the consultants here at Practice Plus.
After which, you will both sign the consent form. They will then escort you through to the procedure room where you will meet the rest of our team and have your test. The procedure room contains a lot of specialist machinery and monitoring equipment. Don't worry, this is here to keep you safe. You will be introduced to the team and asked to confirm your identity. The team will then run through some pre-procedure checks and make sure you are comfortable on our examination trolley. If you have decided to have the light sedation, you'll be given this now. If you have chosen to have Entonox, the nurse will go through how to use the mouthpiece and you can take a few practice breaths. The nurse will remain by your side throughout, making sure you are comfortable, to monitor safety and to answer any questions that you may have during the procedure. You are able to watch the test on the screen if you want to. Once the procedure is finished, you will be taken on the trolley through to the recovery area. Here, the recovery staff will take a handover from the nurse who has been sitting with you for the procedure, and you will remain on the trolley, sat up, to rest for a minimum of 30 minutes whilst we check your observations. During this time, we will also offer you some refreshments and biscuits and make sure you remain comfortable. If you have had sedation We will ask you to call whoever is coming to collect you so that we know that they are in the hospital. Once the observations are completed, we will remove your cannula if you've had one and will leave you to get dressed. Once dressed, the nurse will describe your results and you'll be given a copy of the procedure report, advised of any actions that are needed, and go through our discharge advice sheet. If you would like to have someone with you at this point, we can accommodate this in a room away from other patients who may also be in recovery. We will also ask you to complete our friends and family survey. We aim to keep your experience on our endoscopy unit as safe, dignified and as comfortable as possible, and we always welcome feedback so we can improve and maintain our service for patients in the future. Thank you.